Welcome to a comprehensive overview of cerebrovascular accident, or stroke, and the pivotal role nurses play in every stage of care. Stroke is a sudden neurological event caused by disruption of blood flow to the brain and is a medical emergency requiring rapid action. Types of stroke include ischemic stroke, caused by blockage, and hemorrhagic stroke, caused by vessel rupture. Ischemic stroke accounts for about 80 to 85% of cases and often involves a thrombus or embolus blocking cerebral blood flow. A real-life example shows a 68-year-old with atrial fibrillation experiencing sudden weakness and speech trouble due to a cardiac origin clot. Hemorrhagic stroke involves vessel rupture with bleeding into brain tissue or surrounding spaces, often linked to hypertension. A classic hemorrhagic example is a severe thunderclap headache described as the worst of life, with abrupt neurologic changes. Pathophysiology highlights that ischemic stroke reduces oxygen and glucose delivery, creating a core infarct with a surrounding potentially salvageable penumbra. In hemorrhagic stroke, blood accumulation raises intracranial pressure, leading to further neuronal injury. Time is brain reminds us that every minute without treatment costs millions of neurons lost. Modifiable risk factors include hypertension, diabetes, hyperlipidemia, smoking, obesity, and sedentary lifestyle. Non-modifiable risks include age, male gender slightly higher risk, family history, and prior TIA or stroke. Clinical manifestations span motor, speech, sensory, visual, and cognitive changes to alert patients and caregivers. A practical nursing example shows a patient struggling to lift an arm with facial droop, prompting rapid stroke team activation. Nursing assessment relies on FAST or NI stroke scale to establish a baseline and monitor changes. Initial assessment also includes airway, breathing, circulation, and ensuring adequate oxygenation. In the acute phase, emergency stabilization focuses on airway protection, breathing, and circulation. Medication management includes TPA eligibility for ischemic stroke and careful monitoring for bleeding during infusion. Ongoing care requires frequent neurological checks, hydration, and nutrition assessment with swallowing precautions. Early mobilization guided by physical therapy helps prevent deconditioning and promotes recovery. Rehabilitation emphasizes ADLs, assistive devices, and emotional support for adapting to life after stroke. Patient education covers medication adherence, risk factor modification, and recognizing recurrent warning signs. Family involvement is essential, teaching safe transfers, nutrition strategies, and signs of recurrence. Complication prevention includes swallowing assessments, preventing aspiration, DVT prevention, and skincare. Prevention of aspiration pneumonia is achieved by diet modification and careful oral care. DVT prevention includes mobility and, when appropriate, prophylactic measures and compression devices. Pressure ulcer prevention relies on frequent repositioning and meticulous skincare. Contracture prevention involves range of motion exercises to maintain joint flexibility. Key takeaways for nurses include early recognition, rapid response, continuous monitoring, holistic care, and education. The conclusion emphasizes that nurses are central to stroke care from onset through rehabilitation and long-term support. Final thought, every nurse has the potential to be a stroke lifesaver through knowledge, skill, and compassionate care. This scene introduces the full video rhythm with a calm background track to support learning without distraction. Acute ischemic stroke can benefit from timely thrombolysis when criteria are met. Under strict monitoring, NIH stroke scale scoring helps quantify severity and guide treatment decisions in the emergency department. FAST assessment remains a quick, practical tool for laypersons and professionals to identify stroke signs fast. Vital signs monitoring is continuous, with attention to blood pressure, heart rate, respiratory status, and oxygenation. Airway protection and swallow precautions reduce the risk of aspiration during early recovery. Rehabilitation is a team effort, integrating physical therapy, occupational therapy, and speech therapy. Patient education materials empower survivors and families to sustain recovery and prevent recurrence.